Good afternoon or good morning, depending on where you are currently listening in from. This is the Reverend Dr. Shalita Mira, and I am the owner and founder of the Heart-Centered Journey Counseling, Coaching, and Consultation. And today we are going to bring you our first installment for 2022 of Heart-Centered Wellness, because this year we intend to be intentional about our mental health. And so in the month of January, we have decided to focus on depression. Our goal here at the Heart-Centered Journey is to equip communities with wellness strategies for the mind, body, and the spirit. So we're going to talk a little bit today about depression. And when we think about depression, one of the graphics that I wanted to open our series with is that depression is often known as the silent epidemic. We have heard of the slogan, "What happens in this house stays in this house." Oftentimes that can be applied to things that may be traumatic in nature. But oftentimes when we experience depression, because there's so much stigma around depression, there is a lack of understanding specific to mental illness overall. We tend to keep depression internal. So we internalize the depression. And when we internalize the symptoms, when we internalize its impact, it has a way of negatively or adversely impacting every area of our life. So I wanted to start with the poem. For those who may not really understand depression or may not have ever experienced depression, I did place a couple of poems because I wanted this particular workshop to be experiential. And so the experiential nature of it, for those who have not ever experienced depression, is really going to be felt through the use of some experiential pieces that will allow for you to understand what a person who may be experiencing depression is going through. And so this particular piece here is called the poem Broken Wing by Reyes. And in this poem, it says, "I feel like a bird with a broken wing, damaged by all the bad I've seen. I want to fly away with you and feel new things, but I get frustrated. I can't yet, so I let off steam. Sometimes I feel trapped up on a beam, high above a crowded scene, reluctant to move, for I fear our fall. I know I can't fly all the way yet, and so I stall. I make up excuses to change the focus. I can't stand my condition, so I try not to let anyone notice. I hide it inside like there's something wrong, but sometimes the list can get really long. Please understand when it happens and just sit with me here. Sometimes I will need you to dry my tears. Stay by my side as I learn how to glide. Help me one step at a time so we can finally fly." So let's spend a little bit of time looking at some of the statistics. Why depression is an important topic of focus. Depression is a common mental illness disorder, and it affects up to 26% of the US population. Globally, we see about 264 million people of all ages are suffering from depression. Statistically, depression is now the leading cause of disability in the world. In the United States, and second throughout the world, trailing only ischemic heart disease. More women are affected by depression than men, but the rates of depression in men are rapidly increasing. And it is depression that often leads to suicidal ideation or completed acts of suicide. Suicide is the second leading cause of death in our 15 to 29-year-olds. And suicide is a global phenomenon. In fact, 77% of suicides occur in low to middle income countries. And it accounts for about 1.3% of all deaths worldwide, making it the 17th leading cause of death in 2019. We're talking about 700,000 individuals per year. One person every 40 seconds. This is why we are having this conversation today, because our goal is to really be intentional about educating our communities, educating our churches, educating our educational institution, educating our families about the adverse impacts of depression. The median age where depression is diagnosed is around age 32, which is a major life shift for most individuals when we think about starting families, the precipice of our careers, maybe finishing higher education. 35% of adults who will not receive treatment for depression. And we say about 17.7 million Americans annually will experience the symptomology of depression. And 50% have that chance of having a second or subsequent episode of depression. And in the United States, and I want you to know that 5 years ago, depression was not the #1 leading cause, but now depression is the #1 leading cause of disability in the United States. And we see this comes from the American Psychological Association and National Institute of Mental Health statistics. So how do we define depression? For those of you who may say, I think I know someone, or maybe I've been experiencing some depressive symptoms, we're going to talk about those. So depression is a common but very serious mood disorder characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities that we once enjoyed. Depression can also present as physical symptoms such as chronic pain or digestive issues. So it has an emotional impact. It also has a physiological impact on our bodies. Depression, according to Rupi Kaur, she's a poet, depression is silent. You never hear it coming, and suddenly it's the loudest voice in your head. I want you to think about the helplessness that one may feel when they're experiencing depressive symptomology. It is paralyzing. Oftentimes, those who are experiencing depression will describe it as feeling as though they're in a deep, dark hole. That is why we have to continue to educate and bring awareness to depression. So let's continue to look at the defining characteristics of depression. So in the DSM, depression falls under the category of depressive mood disorders. And common features of all mood disorders is the presence of sad, empty, or irritable mood, somatic or cognitive changes that affect an individual's capacity to function. So it has an impact on the individual's ability to go to work, to go to school, to perform normal everyday tasks. Grooming is impacted, decision-making impacted. It holistically impacts an individual's ability to function. Some of the categories include disruptive mood dysregulation disorder, which is commonly diagnosed in our children and adolescents, which can actually mimic more irritability or disruptive behavioral displays. And then we also have the category of major depressive disorder, which can be single or recurrent. So it can be one episode, or there can be multiple episodes, which can be mild in etiology, moderate or severe. And The symptoms can come with or without psychosis. So that is also extremely important to note. And it can be specified or travel with some anxious distress, which means some anxious mood that can be mild, moderate, or severe. It can be seasonal. So we hear about seasonal affectiveness disorder. It can be peri or postpartum, meaning that it can happen at the beginning, during, or after the birth of a child. And it can also travel with something that's called catatonia. And this is when the depression is so severe that it is paralyzing. It paralyzes an individual's ability to respond to stimuli. And that then really has an impact on their ability to even get up out of the bed in the mornings, to attend to normal grooming and those tasks that are important for everyday survival. So let's look at more specifically some depressive symptomology. We see here decreased interest in activities or the inability to enjoy previously enjoyed activities, hopelessness, persistent boredom or low energy, social isolation, poor communication, low self-esteem or feelings of guilt, extreme sensitivity or rejection, extreme sensitivity to rejection or failure, increased irritability, anger, or hostility, poor appetite or overeating, insomnia or hypersomnia, which is not sleeping enough or sleeping too much, low energy or fatigue. It can manifest as difficulty in relationships, frequent complaints of physical illness, frequent absence from school or poor performance in school, concentration difficulties, changes in eating or sleeping patterns, talk of or efforts to run away from home, and thoughts or expressions of suicidal ideation or other self-harm or self-destructive behaviors such as cutting or burning oneself. There's another experiential piece by Rupi Kaur. Yesterday when I woke up, the sun fell to the ground and rolled away. Flowers beheaded themselves. All that's left alive here is me, and I barely feel like living. Depression is a shadow living inside of me. So let's look at some demographic statistics for just a moment. 63% of African Americans believe that depression is a personal weakness. And only 31% of African Americans believe that depression was a health problem. African Americans were more likely to believe that depression was normal than the overall survey average when other demographics were surveyed. 56% of African Americans believe that depression was a normal part of aging. 45% believe that it was normal for a mother to feel depressed at least 2 weeks after giving birth, and 40% believe that it was normal for a husband or wife to feel depressed more than a year after the death of a spouse. And so we see that oftentimes, because of the lack of awareness and the lack of education specific to certain mental illnesses, we begin to normalize what is not normal. And when we normalize what is not normal, that means there's going to be a decrease in our help-seeking attitudes. So when we think about the barriers to treatment in the African American community, we see that denial is 40% of that. Embarrassment or shame is 38%. 31% just don't want or refuse the help. 29% is because of lack of money or insurance. So we talk about the health disparities that happen. Fear, 17%. 17% have a lack of knowledge specific to the problem or how to follow up for treatment. 12% just express feeling hopeless. And African Americans were less likely to take an antidepressant for treatment of depression. And only 34% stated that they would even take an antidepressant if it were prescribed by their primary care physician. We have to begin to talk about mental illness in our communities so that we can combat the stigma and improve help-seeking attitudes. Major depression strikes 8% of our youth, ages 12 and older. So depression manifestation is occurring in younger and younger ages. More girls than boys and adolescents have depression, but there are equal rates in childhood. And there are 3 risk factors. We see temperament or negative affectivity, environmental, so adverse child experiences, particularly multiple traumatic experiences, and then genetics. So there is a biological or a genetic etiology to depression, which means that an individual who has that genetic predisposition is 2 to 4 times more likely to develop depression, especially if it's a first-degree relative, so like a mother or a grandmother, a father or a grandfather, or another sibling when we talk about the degrees of relation. Dean Atta said, "You have no friends. No one could understand. You deserve to feel this. By relating to others who feel this, you welcome it and only have yourself to blame. When someone equates theirs to yours, they're just trying to feel less alone. You don't want help. They want to trap you here forever. These are some of the lies that depression tells you." We talked just a few minutes ago about the manifestation of guilt and self-defeating talk that happens with depression. And oftentimes when an individual is experiencing episodes of depression and the symptoms of depression, they will tend to have what's called this negative internal dialogue. And this negative internal dialogue promotes feelings of guilt. It promotes this self-defeating internal dialogue that also motivates an individual to run from the help seeking that is required to help. Hence, feeling alone, the increase of the hopelessness and the helplessness. It's another reason why we have to continue to talk about it, so we can be intentional about our mental health. So let's spend a few moments looking at this diagram, which is the cycle of depression. We see that depression typically happens with the onset of some stressor. And the stressor can be any situation that causes strain or hardship. And it can be either short-term or long-term. Now, please know that depressive symptomology can also come from other biological factors and can come from medication side effects. So when we talk about this particular cycle of depression, please know that there can be some other triggers or some other activating events specific to the onset of depressive symptomology. But from that stressor, thoughts begin to manifest. So stressors often lead to negative thoughts, which can be irrational or exaggerated. So we call this catastrophizing, magnifying the thought. Example, I need to be perfect. Nobody likes me. I'm not good at anything. Then there's the feeling that manifests, and the way a person thinks about something has a major impact on how they feel, and vice versa. So we have sadness and anger and hopelessness and loneliness. And then those feelings, the body responds to stressors and negative thoughts and feelings with physical symptoms. So fatigue and sleep problems, we see poor concentration, we see loss of motivation. And then that kind of spirals into a behavioral response. So the way a person acts in response to thoughts, feelings, and symptoms may worsen the stressors or create new stressors, such as social isolation, neglecting daily tasks, the use of substances, drugs, or alcohol. So you see here in this diagram, this cyclical behavior of the symptoms of depression that can keep it cycling. Our goal is to break the cycle. So let's spend just a moment talking about suicide. We briefly touched on it earlier. And just a reminder that every 40 seconds, someone in the world dies by suicide. And every 41 seconds, someone is left to make sense of it. There's a survivor on the other side of the suicidal completion. So suicide is the fourth leading cause of death in our children, aged 10 to 15. It's the second leading cause of death among adolescents and young adults aged 15 to 29. And the rates of suicide attempts are 3 times higher in females, but completed suicides are 5 times higher in our males. What are some of the warning signs? Warning signs include talking about suicide, maybe some change in behavior specific to acquiring means to commit suicide, such as purchasing guns or stockpiling medications, withdrawing from social contact, having rapid mood swings. There may be this preoccupation with death, dying, or violence, expressions of feeling trapped or hopeless about a situation. There can be an increase in the use of alcohol or drugs or other risky behaviors such as sexual deviance or risky sexual behaviors. There can be changes in eating or sleeping patterns, riskier self-destructive behaviors, giving away belongings or saying goodbye to people as though you will not see them again. If you see one exhibiting or experiencing any of these signs, you want to make sure that you try to connect them to the appropriate resources. There's nothing wrong with reaching out to a mental health professional or encouraging them to reach out to a mental health professional, letting their support system know the concerns that you have, and also connecting them through the suicide hotline. In 2017, the U.S. Department of Health and Human Services Office of Minority Health reported that suicide death among Black females aged 13 to 19 rose by 182% between 2001 and 2017, while the rate among Black teen males rose 60% during that time. And we must remember that the statistics are still being gathered specific to COVID and the effects of COVID-19 on our communities, adults, teens, and our youth. Again, I want to remind you the importance of having these conversations so that we all can be intentional about our mental wellness. The biological etiology, just to touch on this momentarily, because there is a biological etiology to depression. So the genetic factor, you're 2 to 3 times more common in people with a first-degree relative with the disorder. There's the biological factors. So the primary defect sites are the prefrontal cortex or the basal ganglia. So if there are any traumas to those particular areas, that can have an impact on the experience of depression. There are psychosocial factors. There is an unclear relationship between psychological stress, stressful life events, and the onset of depression. And then the pharmacologic factors, we talked about that a little bit a few minutes ago, specific to certain drugs being prescribed for certain medical conditions and psychiatric conditions that can cause depression. And so when we think about depression assessment and treatment, some of the things that we do specific to treatment as psychiatrists, psychologists, mental health therapists, licensed clinical social workers, is we want to make sure that an appropriate psychological or psychiatric evaluation is completed. Meaning that for those of you who may feel that there's someone close to you, family, friend, child, someone in your congregation, someone in your community, connect them. Be a linking agent to an appropriate mental health professional in the community. There are screening tools that are readily accessible on the internet. If you think that a loved one may be experiencing some of the symptoms, there's the child behavior checklist, there's the Beck inventory that you can have them take just to assist them in identifying some of those behaviors, just getting them to talk about the fact that they're experiencing the symptoms so that you can be a support. These same assessments and tools are used in the actual therapeutic session. Comprehensive treatment includes both individual, family therapy, and medication therapy. So medication is a part of it. I know there are certain demographics who are hesitant and resistant to medication, but when there's a hormonal imbalance, a medication is highly effective in the treatment of depression symptoms. And then there are antidepressant medications such as SSRIs that are commonly used, such as Paxil, Zoloft, and Prozac. And there are others as well, such as Wellbutrin. And so you want to connect with the appropriate mental health professionals so that a comprehensive treatment plan can be developed for mental health care and wellness. Some additional coping strategies include cognitive behavioral therapy. Strategies such as thought stopping, helping the individual to identify the negative or irrational thought and to restructure that thought so that we can renew our mind. Prayer and scripture reading when we look at spiritual coping strategies. Other coping strategies include exercising, going to the gym, getting out in nature and going for a walk in a local park. Not spending a lot of time in isolation, trying to spend more time with friends or close family members, using the appropriate safety precautions when we think about COVID. Do something fun and rewarding that you enjoy, engage in activities that are inspirational. You have your church services, you have listening to positive music and podcasts, favorite television shows. We also have books. There are a lot of different things that we can engage in, social media groups. Set small, realistic goals for yourself. Seeing a therapist or a psychiatrist for an evaluation and the development of a treatment plan is key. The other important thing that you may want to think about is joining some groups, some support groups, letting the support groups be a part of your daily routine so that you have that additional support if you're feeling alone or isolated. Additional coping strategies are reading, journaling, affirmations, joining clubs or organizations, meditation, Lectio Divina, which is a Bible reading strategy, learning a new skill or hobby, healthy routines, sports, martial arts, poetry. That's a part of what I embedded into this experiential workshop, was the reading of different poetic pieces. For those individuals who've never experienced depression, can have a way of understanding experientially what an individual who's experiencing these depressive symptoms may go through. music, gardening, and art. There's so many different coping strategies that we can use to help when we are going through, or as a preventative strategy, especially if we find that our depressive symptomology is seasonal or connected to certain days, birthdays, Christmas, holidays of that nature. And in closing, one of the things that I'm encouraging you to do is to develop an outline for your wellness plan specific to depression prevention. And how do we do this? First, recognize the warning signs. You can go back and watch this particular webinar as often as necessary to identify what are the warning signs of depression or depressive symptomology. You want to write down moods or situations that have historically triggered depressive episodes. You want to write those down because they will help you to kind of identify before the depressive episode starts, right? So we want it to be preventative. Know your initial symptoms of depression and when they begin to develop. You want to notify your support group. You can determine this by either conducting a self-assessment, which are a couple of the tools that we can find online, such as the Beck, or you can schedule an appointment with a licensed therapist to do an assessment. You want to identify coping strategies because you want to use your own coping strategies. So list things that you can do to avoid the feelings of depression. List things that bring you pleasure, and also things to avoid so that you can either help prevent, or while you're in the midst of the depressive episode, you have some things to do already identified to kind of increase your motivation as a response to the depressive symptoms. Socialize with others. List people who you can talk to, safe spaces and safe places that you can go that can help restructure some of the thoughts that you may be having or some of the activating stressful events. Reach out to family and friends. So you want to educate your family and friends on the depressive symptomology, maybe on historical incidents of depressive symptomology. Let them know the warning signs so that if you are experiencing the symptoms, or if they notice you're experiencing the symptoms, they can be a source of support. And call in the experts. So list names and numbers of mental health professionals and crises hotlines. When all else fails, schedule emergency appointments with your therapist. There's so many different platforms for therapy now. We have telehealth, right, where you can connect with your therapist virtually. You can connect with your therapist via telephone call or text message, or even in-person therapy. So whatever strategy you need, make sure that you have contact information and a way to contact the therapist in those emergent moments. So schedule those appointments. Also, when it's a good idea to include your crises hotline numbers, like the National Suicide Prevention Lifeline or Crisis Text Line. And do not be afraid of medication. Medication may be something that you have to take for a specified period of time when we think about peri or postpartum, depression, when we think about certain forms of grief, a complicated grief. The medications can be something that's taken for a specified period of time, adjustment-related disorders, but it also may be something that needs to be taken for a longer duration. But do not be afraid of medication. You want to work with your provider so that you can create the best medication and therapeutic regimen for your mental wellness. And if you would like further information, or you would like to attend other trainings, please visit us at the Heart Centered Journey. It's www.theheartcenteredjourneyccinc.com. You can also visit us on Facebook or on YouTube at The Heart Centered Journey. We will be posting one webinar per month that will be focused on a different mental illness to equip you with strategies for your mental wellness. Again, I am the Reverend Dr. Shalita Mira, the owner and founder of the Heart Centered Journey. It is my goal that you are intentional about your wellness because you were created with intention. There is so much for you to accomplish, and we want you to be well, mind, body, and spirit, so that you can enjoy every day of your heart-centered journey.